America'sWebArmy.com. You're listening to America's Web Radio on the America's Broadcast.
Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal Scherz, and every week myself and my co-host, Dr. Scott Barber, alternate and bring you the information that you need so that you can advocate for your family's health and well-being. We talk about the issues that doctors themselves talk about in doctors' lounges all over the country. And we try to give you all the information so that you can digest what is really happening out there and be able to understand what it means when people tell you certain things about certain healthcare issues. And it seems like we're always now talking about healthcare. Our show is brought to you by the Docs for Patient Care Foundation, which is the only healthcare think tank in the country that is run entirely by doctors. Our website is www.d4pcfoundation.org, d4pcfoundation.org. Please, right now in this time where we are out there really fighting the fight, trying to do what you need people like us to do so that we can protect your healthcare freedom, go to our website and donate $5 or $500. No amount is too big, no amount is too small. But for us to continue doing shows like this and do the work around the country, we need you to be part of our team. So please go to our website today. Our guest today is a good friend of mine. I'm not gonna waste a lot of time singing his praises because there's a lot to sing. My guest is Chad Savage, who is first of all, he's a policy fellow at the Docs for Patient Care Foundation and a policy advisor at the Heartland Institute. He is also the president of Direct Primary Care Action, or DPC Action. He is one of the pioneers in the direct primary care movement, the founder of Your Choice Direct Care. And despite the fact that he is a graduate of the University of Michigan, we won't hold it against him. So, Chad, welcome into the Doctor's Lounge.
Well, thanks. I was hoping to get Dr. Barber, but I guess I can't. I got the short end of the stick this week. So,
you know what? You unfortunately did not luck out. That's my phone, and I'm going to mute that. I'm so sorry. So, Chad, you are really, you're a Washington insider now. You've been going to Washington. You have been able to get access to people who are listening to doctors, which is the difference between this administration and the Obama-Biden administration. And their goal for health care was to have the government run everything, and the Trump administration believes that people should be in charge of their health care, not the government and not insurance companies. And I think that you have been successful in helping to shape the opinion and deliver the message. So congratulations to you on that, Dr. Savage. And why don't you share with everybody the receptiveness of the people who you've been able to speak with in Washington?
Sure. Well, thanks, Hal. Obviously, our work has built on what you started. You and I met, if you may not recall, but actually originally was in 2012, and you had been doing work for several years. We met at Docs for Patient Care when it was a membership model, doing calls on Congress. You were quite prescient. You knew what was coming with the changes in the law, and unfortunately, I had to get burned on the stove a couple times before I realized that grabbing it wasn't a great idea. But once I saw what was going on with ACA, and you were just seeing levels of despondent physicians that were never seen before. Prices were skyrocketing. The care was being micromanaged to such a level that it was destroying the doctor-patient relationship. And fundamentally, undermining the entire reason I went to medical school, which was patient care, and we were becoming more, data input bureaucrats. I knew that something had to be done, so I started working with Doctors for Patient Care Foundation way back then, and working locally with people running for office and in office to try to create policy that was more conducive to a good doctor-patient relationship. And a lot of that's just good old hard work, writing letters, shaking hands, meeting with representatives and such. And initially, honestly, it felt like maybe it was a hopeless endeavor, because with the prior administration, we were at the door pleasantly knocking, hoping to have an audience, and we wouldn't even be recognized that we were there. In fact, we were even vilified. There was a book that came out, a little cartoon book describing ACA by it wasn't Ezekiel Emanuel, but it was one of the other architects back in the day, and they had pictures of doctors calling on Congress, which was us, and they did it in a very unflattering light. To see that, us as trying to protect our patients and protect the historic doctor-patient relationship being vilified was quite demoralizing. So when the unexpected occurred in 2016 and President Trump came into office, and suddenly the door swung wide open, and we had policy people inviting us in, wanting our opinion. I mean, it was very, very interesting to I'm out in Michigan. I'm a little doc in a box. I have a small little practice. It's wonderful. It's successful. It's a direct primary care practice. Love it. But to be invited on multiple occasions to speak to these policy experts who are creating, the president's agenda, and they were legitimately asking our advice. I mean, one of the examples I have is last year I was invited to a feedback session at the White House, and I was surrounded by some of the heads of the major insurers. So you had Blue Cross Blue Shield, you had Aetna, and you had HAP and all the others, and then some guy from Brighton, Michigan. And it was interesting. Brian Blaze was, who I know you had on last week, was the one running that meeting. And when they started arguing against price transparency, I believe it was one of the heads of Blue Cross Blue Shield, he rolled his eyes, and I thought that was telling that the old way of doing things, the protecting the establishment quo was not being bought into by this administration. It was very, very nice to see. And then we've had wonderful success working with senators and congressmen, like Ted Cruz and Chip Roy and other true believers in free markets. And so it's great. The hope and prayer for myself and many others is that the success we've had to date is allowed to continue, and obviously in a couple of weeks we'll find out.
Well, you've raised some very good points, and as I said to you off air, I wish that we had a couple of hours today because there's so much to cover. But what you just said, Chad, is a great example of the need to just show up. You
Yep.
are, a small town doctor. I'm a specialist in Atlanta, Georgia. But one person can make a difference, and if a lot of one people get together, it makes a incredible difference. It's very, very powerful. And in fact, you mentioned about white coats. We got ridiculed for that, and yet that whole idea of massing on Congress with white coats was stolen by the Obama administration on their white coat spectacle at the White House shortly preceding and after the signing of the Affordable Care Act. So it's I think that it also underscores the need for every single person to do something and make a difference, including vote. So,
yeah, absolutely.
So
one thing, if I can
yes, please.
digress for a moment back to the administration and the people that are working there. One thing that blew me away is having talked to politicians for many years and having them look with blank stares at the idea of free markets and direct primary care and things that we were doing, even though these were fundamentally changing the dynamic in healthcare. But it was so different from what people are used to in healthcare, because an entire generation of people have been raised with nothing but an insurance or governmental intermediary between them and their doctor. So this was very foreign. That wait, you're talking without insurance? The people were bewildered. But when we started talking to this administration, the first time I met with Brian Blais, I was actually blown away by how quickly he grasped the concepts.
Right.
I mean, so the president, people can squabble about his demeanor, but he surrounds himself with unbelievable people, extremely intelligent people. Brian wasn't only grasping what I was saying, but he was taking it several steps beyond. When I wasn't even done explaining the concept, he immediately grasped it and was thinking down, several steps down the road. So, this administration is chock full of extremely intelligent people who are incredibly competent.
Well, not only that, but they come to this administration with worldly experience and incredible backgrounds. Brian Blais, who we're talking about, came from the Mercatus Institute at George Mason University, one of the most renowned healthcare think tanks in the country. And so Brian was pretty much raised on all of the issues that we talk about all the time that are wrong with medicine, like certificate of need laws and the failed Medicare system. So I think that when the Trump administration started looking for people to fill roles in government, they brought people in who were problem solvers or who had the information. It wasn't more of the same, or people who were looking to line their pockets.
Yeah, and doers. I mean, he didn't just draw from the old well of career politicians. He went out there and found the people that are doing the actual job, who are innovating in their relative industry, and he said, well, what are you doing, and how do we facilitate further innovation? And so successful have we been, if I can tout our own horn,
please,
on that one, is that we got direct primary care, which several years ago no one knew about. When I started mine in 2015, there were just a handful of practices in the nation that were doing it. Now we've got, there's some estimates that perhaps over 2,000 practices in the United States now practicing this model, and we're actually cutting costs while improving the quality of care by cutting out the intermediaries. And by simply going and talking to politicians in D.C. and in this administration, direct primary care was the second item on the president's health care plan, which, I mean, that kind of buy-in for a new model is tremendous. And I like to think that we are not paid, that our hard work has helped that kind of innovation, and hopefully will help the care of patients across the nation.
Okay, so let's pull this back into where we are right now. Every single day, the country is bombarded by political advertisements that are pretty much saying that, first of all, Amy Coney Barrett is is being pushed through so that that Trump can take away their health care. The commercials are saying things like Trump has no interest in protecting people with pre-existing conditions. Lie after lie after lie. So, we can talk about the things that really are the successes of the Trump administration, and in fact, the things that these left leaning or blatantly left advertisers are talking about are things that will happen in a Biden administration, in a Democrat-led health care plan. So why don't you comment on that?
Oh, yeah. Well, there's a funny false equation that people, the way it's being portrayed as though healthcare didn't exist prior to 2010 when ACA was passed into law. like if you pull away the ACA, there will be no health care. Well, that's not true. Health care existed before that, and in many regards, it was actually better, as I alluded to. I felt very personally in my own life the degradation of quality of healthcare with ACA. But now it's been long enough that people forget that, and people tend to have think very temporarily. I mean, it's short term. So they think right now, and they believe this hype, but they forget their own lives and their own lived experience. Medical visits became harder to get, longer waits and shorter, became very bureaucratic and structured by a third party, not by the doctor and the patient. And largely, much of that was because of ACA and the ramifications of ACA. But even more importantly is that was not the end product that was proposed. Even at that time, Harry Reid in the Senate at the time was saying that this was only the starting point. In conversations with donors that were recorded and televised at that time, he said this is the first step, and that the end goal was a single-party payer government-run healthcare system. So people need to remember that is somewhat of a Trojan horse for single-party, and the fact that because it collapses, and how we know it collapses and why it's not good is everyone on both sides of the political aisle want to change or improve upon the ACA, which means it's not working, right? If it was working, they'd say, no, it's perfect just as it is. But that we need to think long term, and we have to have recollections. And it's okay to mention, what happened 10 years ago and refresh people's memories, because if the people on the other side are thinking in that kind of long term game plan, well, we have to too. And we can't just think, well, what I have right now, I'm not dying with it. I can't say it's comfortable because most people are paying exorbitant amounts for their insurance. But in the moment, I don't feel pain. I'm warm. I have enough food in my belly. So therefore, I don't want to change anything because I'm terrified that's going to alter. But we can actually go back to better and improve upon that in a different direction.
Chad, you recently wrote an article that was in Town Hall that is entitled "Debunking the Trump Doesn't Have a Healthcare Plan Myth." Trump certainly does have a healthcare plan, doesn't he?
Yeah, amen. It's just a different philosophy. So I wrote that because after going to his North Carolina announcement of his health plan, I had some of my liberal friends attack me and say, well, he doesn't have a health care plan. And I said, well, yes, he does. They said, well, where do you sign up for it? And that's actually a quote I pulled, and that gave me the inspiration to write that op-ed. And I realized that we were not talking about the same thing. They were talking about a top-down government-run healthcare plan, like literally an insurance-type plan, where I was talking about kind of a plan as in
a framework
to reach a goal.
A framework.
Yeah, a framework. Exactly. And that's much more what the president has. And so they envision a lack of a plan unless you have a spelled out, written out, detailed governmental takeover of healthcare, whereas actually I was proposing, and the president is proposing, a disentanglement of the government from healthcare. And I made the analogy within the article that they're looking for a Hail Mary pass towards single-party payer, and that's the only thing they would accept as a plan, where Trump is actually winning on 5- and 10-yard passes, moving towards the disentanglement of the government and improved medical care.
Well, I think that the thing about what you've just shared with your friend is the fact that since there's no plan to sign up for, that's interpreted as there not being anything. And that's the difference between conservatives and leftists. Leftists believe that the government is, well, let me just say that conservatives believe that people are smart, and that they are capable, and they can, if you give them the opportunity to do things, that they'll be able to succeed. Whereas leftists believe that people are not smart, and that the government needs to take care of them, and hence the reason why, well, if there's no plan to sign up for, there is no plan. And I think
yeah,
that's
it's interesting that that ideology was perfectly laid out in actually the opposition to Mitch Daniel, the precursor to Mike Pence in Indiana as the governor of Indiana. And Mike Pence took over the program for the Healthy Indiana Plan, which was their Medicaid plan. And so people think that if you're a conservative, you don't care about the economically disadvantaged or how to take care of them. But that's not true at all. Actually, Pence had Vice President Pence, when he was governor of Indiana, had a wonderful plan called the Healthy Indiana Plan. And what they did is, instead of having bureaucrats within the government controlling health care, they said, listen, we're going to give some of this purchasing power back to the individual, the patient, the Medicaid recipient, and let them control their health care. Let them determine with their doctor what they want and what they need without going through, costly authorization processes and having bureaucrats tell them no at the last second when they need an MRI or something of that sort. And it was interesting because the cynics out there, the left-wing cynics who were counter to this, actually were quite derogatory, because essentially their argument was, well, you can't do that. I mean, these people are poor. I mean, they're poor, so obviously they're foolish, and they're poor for a reason. And it was really condescending.
Mm-hmm.
And these are the people who are supposedly looking out for these people based on their own proclamations. But in fact, they were the ones most degrading them. And when the dust settled, what they found is that the Medicaid recipients, the indigent, were much better at managing those funds than the insurance company and governmental bureaucrats. And they had a reduction in costs in the Medicaid program by around 20%, and they had satisfaction levels in excess of 95%.
Right.
So, in Medicaid. So that's an incredible success story by trusting people to manage their own funds, to manage their own lives, and recognize that no one knows more about your own life than you do, and you're the best person positioned to make judgments, unless you have a true mental deficiency, your profound dementia or something of that sort. When of course some agency could step in and try to protect those people. But those are the rare case. The vast majority of people are well equipped to make their own decision making.
100%. So the Joe Biden plan is to strengthen Obamacare. He believes that that's the answer. And he thinks that the way to do that will be by having another insurance company that is run by the government option plan, to compete in the marketplace with the existing insurance companies. So why don't you comment on what that means to healthcare, to the system, and to direct primary care?
Well, I think it's kind of funny that he says strengthening the ACA, because actually I would argue, though he's a proponent to the original law, President Trump has done more to improve the ACA than Biden or Obama ever did. And the reason why is when it first came into play, the competition within the insurance market dwindled dramatically. Mm-hmm. The number of options, the insurers who fled the market,
yes,
was astronomical. And what you had was I don't remember the exact number, but it was something like 90% of the communities out there had only one or two options within the exchange.
Some had none.
Not a market.
Some had none.
Yeah, or none. And under President Trump, that's actually improved dramatically. Now people have multiple choices within those ACA exchanges. Also, between 2013 to 2017, premiums doubled. And then once the Trump administration started having effect in that's now stabilized. Those increases, you're not seeing 20% increases in premium every single year under this administration. The big worries are he wants to bring back bad aspects. Vice President Biden, he wants to bring back things like the individual mandate, which for those who recall, that was a penalty issued by the government for people who didn't want to buy a government-sanctioned health care product. And why that was so bad is, for one, if you couldn't afford it, you were penalized. You were actually harming those who couldn't afford these priced products. I mean, it was a really nice gimme to the insurance companies to say, well, these people are either they buy your product or they're going to be penalized. And it was again called a tax by the Supreme Court, which saved them. But the individual mandate, why it was so negative and why he didn't get rid of it, President Trump, he reduced the penalty to zero, which effectively neutered it. And Biden has said he's going to bring it back. And why that's so harmful is when it was taken down to zero, it allowed for other insurance products to come back onto the market. And short-term limited duration plans are one of those examples. And those are 80% less expensive than the exchange products. It also allowed indemnity plans and an expansion of the health sharing ministries, which already existed and had an exemption of the ACA, but only 4 of them were exempt at that time. And now a plethora of them are coming onto the market, giving people a lot more choices on what they do for coverage. And I had another op-ed out there where I talked about my own family. And we decided to go the health sharing ministry route. And between DPC and using a health sharing ministry, so this is not the deprivation of medical care. We are getting medical care, I'd argue better medical care under my DPC doctor, my direct primary care doctor, and health my coverage for catastrophic under my health sharing ministry. In the last 5 years, my family of 4 has saved $88,000 over the premium alone that we would have suffered under an ACA exchange product.
That is startling.
Op-ed, oh, yeah. And in that op-ed, I extrapolate that savings to 10 years. That means the average family of 4 could buy a house every 10 years with not the deprivation of care, but with the savings on health care by just changing how we pay for the system.
Amazing.
Nothing else changed other than how we paid for the system.
That is really unbelievable. And the other things that Trump has done to strengthen health care that he gets no credit for are things like the association health plans, where groups can come together and pool their risk and save money, and the ability for employers to earmark money to pay for employee health care through HRAs, health reimbursement accounts. And hopefully in the next Trump administration, we'll be able to see the full utilization of HSAs for all health care, including direct primary care.
Yeah. So many of these things that have been implemented have not had a chance to fully ossify. So we have only scratched the surface. The benefits have been profound. And many of them have more recently been implemented, which means, it takes time for those advantages for the insurance companies who are offering the alternative coverage products to come on the market, to start offering. It takes several years to really see that. We're already seeing advantage from that, and we really need a chance for that to ossify, to see the maximal potential of those changes.
Right.
And my worry is with the change of administration, they may cut that off at the knees before it even has a chance to really advantage people.
No, not may. They will. And this is why everybody needs to, if they're interested in preserving their health care freedom, they need to understand this and go to the polls and vote for their pocketbook and vote for their children's future, which is quite clear. We've got a hard break right now, Chad, and I want to spend the next half hour, the next half of the show, talking about COVID, because it really is sucking all the oxygen out of the news cycle. So stay with us, and we'll be back.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Scherz, every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
We're back in the Doctor's Lounge with my guest, Chad Savage, a direct primary care doctor, the founder of Your Choice Direct Care Michigan, and the president of DPC Action, a longtime friend and a healthcare warrior along with me. In this segment, Chad, I wanted to talk about COVID, which is really sucking all the oxygen out of the room. And, I am writing a piece right now that is the things that I hate about COVID coverage. And it's truly, it's gone out of control. The blame game on Trump, the shutdowns, the false reporting. I'm gonna kind of go through the things that I hate, and I think that'll be really a great jumping off point for conversation. So one of the things that really just get under my skin is the fact that right now there are 325 million experts on COVID. Right? I mean, is it?
Oh yeah, no doubt.
I've been a doctor.
Interestingly, though, a unique situation where physicians don't, for one of the first times in history, we don't necessarily have unique or more information than the average person can access on this condition. It's probably the first disease like we've ever had.
Yes.
Where intelligent people can understand numbers can actually look at this.
No, I would
draw a reasonable conclusion.
I would argue with you about that. I've been, a physician for almost 40 years, and it has taken a career to know how to critically analyze medical literature and determine whether or not it's valid or not. And doctors have journal clubs for that reason, so that they can discuss these papers and decide whether or not the methodology was correct, whether or not the conclusions are correct. I had a professor who always said, never let the data interfere with your conclusions. And we've reached a point right now where if somebody, yells squirrel, everybody, turns their head to look. And it's really, it's impossible for the lay public to be able to reach rational conclusions about what is being written in medical literature.
I didn't say the conclusions necessarily. I meant the access to the information itself.
Yeah.
So if you are able to scrutinize it correctly, you can. And one of the interesting things, though, to kind of push back on that is that the people who most should be well equipped to make appropriate determinations based on their training are coming up with some of the most implausible explanations.
Yes.
So it's the very medical experts, that we usually defer to, that are coming up with very, very harmful policies and bizarre interpretations of the data, making solely single variant analysis, only looking at COVID, not looking at all on the ramifications of the interventions that they're doing themselves and how that can destroy lives and even kill people.
So that's number 2 and number 4 on my list. So you're
just trying to steal your glory there.
Not at all. No, you're. I think that people who are rational human beings, and I'd like to think that both you and I are, can really look at this not in a political way, but actually be able to look at this critically. And you turn on the TV, and every day, every news show on mainstream media, cable news, has a doctor on. And just because you have an MD or DO after your name doesn't mean that you are an expert on COVID. And yet these people are, the reason why they're on certain broadcasts is because they share a view that is consistent with the outlet that is reporting the news.
Yeah, and even amongst MDs, and DOs, you'll have people criticizing and saying, well, if you're not an epidemiologist, you can't speak on it. Oh, well, you're an epidemiologist. Well, you're not an infectious disease specialist. I mean, basically, it's not the person's credentials or ability to interpret the data. If fundamentally you're saying something that doesn't agree with my preconceived notion, so therefore I'm going to invalidate you in some way. And Scott Atlas is the classic example of that.
He is.
Since though he's incredibly rational, he's not a trained epidemiologist. So the irony of that is on CNN you get someone like Sanjay Gupta, who's a neurosurgeon, who's criticizing the radiologists because they're not an epidemiologist and can't interpret the data, even though he's interpreting the data as a neurosurgeon.
Right.
So the hypocrisy is profound.
It is just that. It's all hypocrisy, and when people are staying at home and they are tuned into these broadcasts, and this is what they're hearing 24/7, literally 24/7.
The death ticker on the bottom of the screen.
Yeah.
I mean, it's terrifying stuff. It really, the president talks about not trying to induce a panic, and I think that's a really good thing. I mean, what advantage would panic have? So he's a half full kind of guy, and I can understand that people could look at it and be more pessimistic and think half empty. And in normal times, we would have people of goodwill who would be looking at these problems, and politics wouldn't be on the table at all with addressing something like this. It's actually ghastly that's taken over the discourse on COVID. I mean, this should not and never should have been politicized at all, but because people could see political advantage by vilifying via COVID, it's become political. And I mean, you shouldn't be able to predict based on someone's stance of whether we should wear masks or not, what party affiliation they have, and yet that seems to be the case.
Well, masks. This is one of the item 5 on my list.
Mm-hmm.
I don't know. How your practice is handling this, but where
we don't have a choice.
Well, I know. You
we're
are
in Michigan. And
yes, you're in the People's Republic of Michigan.
Our licenses have literally been threatened if we don't use them. Many police departments locally have said they will not enforce that. So the governor said, "Oh well, geez, if the police departments are going to enforce it, how do I make it? I know. I'll threaten the businesses' licenses," which is just an incredible aberration of how licensing should ever be done.
It's an abuse of power.
Just colossal abuse of power. And is this reflexive authoritarianism, do what I do or I'm going to punish you.
Right.
And to use the licensing bureau as a mechanism is just, that's incredible bastardization of the licensing authority.
Well, let's circle back to masks, because what I wanted to say is that in our practice, just like most medical practices, what we're trying to convey to our patients is that there is concern about their safety and well-being. And so, we make sure that nobody comes into our office without wearing a mask. If you don't have one, we will provide one. Temperature checks. We clean the rooms between patients and social distancing when we can.
Mm-hmm. Reasonable measures.
All the reasonable measures. But what is really just maddening to me is the fact that probably over 50% or more, and this is anecdotal because I don't have real data, and I don't want people to think that I'm making it up, but more than half of the people that I see do not have their masks on properly. They have their nose exposed. They have them partially hanging down so their mouth is open. They will. It's just laughable. And we're the people who are out there who are making the case that masks will solve this pandemic are also politically inspired. You look at Robert Redfield, the head of the CDC, who sat in Senate hearings waving a mask, saying this will prevent 99% of COVID transmission. And then the next day, the CDC came out with a statement that said masks do not protect you; they protect others. So they talk against both. There's no real science behind any of this.
So it's the insane deviation from the historic reasoned approach and cautious and avoiding hyperventilating. And we're supposed to be somewhat emotionally disconnected as physicians, but for whatever reason people are incredibly emotionally invested in an outcome. We should be looking at these things impartially and looking for truth, not looking for that which fits my preconceived notion. And that's unfortunately what's really going on. Because with the masks itself, as recently as May, the CDC had a document saying there really is no science backing this up. They did a meta-analysis where they looked at prior studies looking at mask use, and a lot of this was pre-COVID, so they had to find analogous viruses like influenza, and they found that there really was no data supporting a lack of transmission when wearing a mask. In fact, it wasn't a lack of data; it was negative data. They suggested it didn't work. And then just 2 months later, in July, and trust me, there hadn't been just this massive wealth of new studies that came out in that 2 months. They totally flipped their position, and their position paper was saying, the science supports the use of masks. And you looked at you'd reference it. So I looked at it. I thought, wow, that's a big change. So I went down to the reference area, and the studies they were referring to were not actual transmission studies. They were kinetic studies, meaning they used so these are not totally invalid, but they used slow motion cameras to see how particles moved in the air, and then they made suppositions about transmission rates based on the movement of those particles in the air. So that's plausible, right? That's a plausible mechanism of action. But as we've been burned many times in the medical community, plausible explanations do not always meet reality.
Right.
So what and also, again, single variant. It's looking at the movement of particles in a perfectly positioned mask that's fresh and new. What we know about that is this is not how people wear masks. And study protocols are always optimized worlds. Real world usage of meds and medical devices don't always reflect the optimized setting in a study. And we know, for example, I believe it's 14-fold increase in face touching when you're wearing a mask. And I don't know about other people, but I have a lot of trouble touching my mask all the time. And touching the outside of the mask does not get rid of your risk, because you can touch the outside of the mask and then later rub your eye and contaminate yourself through the nasolacrimal duct, the little duct that drains off the eyeball. So, and they know that the masks get saturated with moisture within about 20 to 30 minutes, and their utility goes way down at that point. And I've seen people who come in, and there was a lady I saw the other day who she pulled off her mask, and it was a paper mask, and it had numerous shades of lipstick on the inside, which meant she has been wearing this thing for weeks on end, and it was covered in putrescence. And I was like, oh my gosh, you got this spittle-soaked rag pushed against your face, and that's supposed to be healthy.
Yes.
So and of course she was wearing it beneath her nose anyway.
Right.
This was essentially something to simply allow her to get out of the governor's order that you had to wear a mask. It was not doing anything functionally to protect her or other people, and in fact may be exposing her to risk the way it was being worn. And that's, the sad truth is that's the reality.
That is the reality. And people,
cloth masks, people are not washing those every single day.
No, they're not. You go to a restaurant, for example, and the waiter is wearing a mask, but they're fiddling around with it, and then they're touching your plates. And so this whole regime is just, it's basically a narrative to support a position, and there's no science at all behind it, and yet it's become so politicized and so emotional that if you're not wearing a mask, you're a criminal.
What I'd love to see is they've got those germ replicating fluorescing solutions that you can put on your hands to show how well they wash, and you can spit them out and they can follow them. Is a lot of people, when they cough or sneeze and they've got a mask on, they'll put their hand up to the mask, push it against their face, and cough. Well, these things are not N95s. I mean, there's stuff is going between the fabric. So I bet you they're covering their hand in germs when they do that. Whereas prior to COVID, the way of handling that was actually to cough into your elbow.
Yes.
Instead of putting that over your face and coughing into your hand with a porous
That's right.
paper or cloth in between, your elbow is actually probably safer. And in reality, most of the spread, if you can believe, again, the kinetic studies, is when people cough or sneeze, because those are just plumes that come out during those times. Restful breathing patterns are not as dangerous. So you could use an intermittent facial covering for those times when you cough or sneeze, because historically that's called a Kleenex. So it's an intermittent facial covering,
right,
and
exactly.
you use it during the times when you're most at risk of transmission. That's when you're coughing or sneezing, and thankfully most people have a concept that they're about to do so and can put something against their face,
Exactly.
an elbow sleeve or something.
Let's pivot for a second and talk about the reporting regime. Can the media be trusted? That's really the answer. Every night we hear the figure about how many deaths there have been in the U.S. and how many cases there are and how many new cases there are. Isn't really, the number of cases, there's been now, 40 million cases, 40 million positive, COVID patients. Let me ask you this. Does that really matter? That's like keeping a running score. It's like, saying to somebody who is making $40,000 a year that they're a millionaire because over the course of their life they've made over $1 million. That's irrelevant. It's what we're seeing at a particular point in time. And the real statistic that is important is what is the survivability of COVID if you get it. And right now it's 99.7%. And all this other reporting is fear-mongering.
Yeah, absolutely. The problem with case counts is it's not really the case that matters, it's the consequence of the case.
Yes.
So if for example, this became purely asymptomatic, it wouldn't matter if there were 7 billion, every single person in the world contracted it, if there's no consequence of that contraction. So really the hospitalization fatality rates, are much more relevant. Thankfully, those have been fairly low. I know there may be a slight uptick recently, and obviously we hope it doesn't go much higher. But cases alone are somewhat of a fear-mongering, and it's very much a detection bias, too, because if you're testing like crazy, you're going to find a lot of asymptomatic cases. If you look at just our own state of Michigan here, we have essentially as many cases now as we did in the height in early April, when there were 250 deaths a day from COVID in the state of Michigan. Well, we're like either single or barely into the double digits in the state of Michigan with that same case count. And that's not, that's because they were probably vastly undercounted then, and they're now perhaps even be overcounted now. So you've got to really look at those, the ramifications. No one would care about blood pressure if it wasn't associated with heart attacks,
right,
if it wasn't associated with strokes. We care about it because of the consequence.
Right.
So we really need to look at that. And talking about the media a little more, the coverage, what makes me most fearful about the coverage is the censorship that's occurring within the coverage.
Right.
Because historically, when you had something, anything going on in society, you'll have two competing theories, and you'll hear people debating,
or more.
Yeah, exactly. You'll have multiple ideas, and they're openly exchanging ideas and debating within the public square, and this allows people to kind of listen to the various arguments and draw their own conclusions. Well, you have an intentional suppression of one side of that debate, and more than suppression, pure, flat-out censorship.
Right. Scott Atlas got delisted from Twitter.
Yeah,
he's part of the task force.
Early on, from the urgent care in California, who were reporting that they were finding numbers far less than the publicly reported numbers at that time from the CDC, and they were widely derided and censored from the internet. And yet, subsequently, now it turned out that they were probably right. Their numbers were much more accurate than the CDC's numbers at that time, and yet they were censored from the internet. Why this is so bad is that what it leaves, all that's left after all the censorship, so you don't get the people are very, very scared, and again, maybe that's justified. But then you get people who are more calm and rational, and people find some happy place in between that maybe they themselves agree with, between the two extremes. Well, now you're left with one extreme. Only the hyperventilating, screaming, crazy, the world's going to end, and there's no countermeasure to that. So people given a lifetime of double opinions now are only left with one opinion. They say, oh my God, normally I hear a countervailing argument. I hear no countervailing argument. That means the world really is going to end, that everybody's in agreement.
Right.
And I think it's actually made the response to COVID far worse. The censorship has been exceedingly damaging.
Yeah, 100%. So we got 10 minutes left. I'm going to do lightning round on a couple of things. So people are dying at a far lower rate than they did initially, as you pointed out in Michigan. And part of that is probably that we have better mitigation. It means that we're able to social distance. We cleaning surfaces. We're washing hands. Maybe better therapeutics. There's a lot of people who are doing things like taking vitamin D or zinc or things like that. But the question is, do you think that the virus is changing, Chad? Is it attenuating, you think?
Well, I'm going to say something that's very, very controversial.
No.
I don't know. I don't know. No one will say that. I don't know.
Right.
You know, everybody has to feel like they have to come up with some argument. I'm actually not sure. There's many possible explanations for that. One potential explanation, it's not the same risk people that are being infected.
Right.
So we see many more cases, but since not all over the place, but sometimes, you know, the younger people are back engaging in their lives as they should be, are contracting it. Well, they have vastly lower chance of suffering a consequence.
Right. All the nursing home,
the elderly.
All the nursing home patients have been killed by the governors in their states already.
Yeah, I mean it's a really dark statement, but there's some truth to it.
Yeah.
You know, the people who are most susceptible have largely passed from it. That doesn't mean that others may not too. And you know, obviously, you know, if you're going to put money and efforts into protecting anyone, it should be those who are most at risk. In fact, I would argue that when this is all said and done and we look back, we're going to realize that this was primarily a disease of the vulnerable elderly, and how we responded by shutting schools just makes no sense.
Great.
I mean, the opposite argument would be true. If you had a disease that almost exclusively killed children, would you shut down the elder care facilities?
Exactly.
I mean,
there we go. Now
so
I want to go back to this because this is really one of the 3 points I wanted to make in the lightning round. So schools, shutting down the schools. I'm going to throw out a couple of things. I'm going to give you, a couple of minutes to talk about them. So shutting down the schools. Aren't teachers essential workers, just like people who are stocking the grocery stores? I would maintain that they're much more essential workers, and yet we're letting the teachers' unions, their tail wag the dog. And you know, we've had areas, or not area. We've had instances in our history where there have been really bad diseases that have been out there, and we've not shut down society. We've had polio in the 1950s, and people were deathly afraid, and yet we didn't stop living. We didn't stop, going to work or going to school. There was HIV in the 1980s. People didn't know where HIV was coming from. There was some thoughts, but nobody really knew, and it was ravaging, populations in this country, and we still don't have a cure for that. So, mental health of people are being affected by this shutdown, especially children, where the suicide rate in children's hospitals are being reported going up at alarming rates. So I'm going to give you about 3 minutes to comment on those things, because I want to say one more thing before we have to leave.
Sure. Well, everything you said, I agree with, and I think prior generations recognized that you can't shut down society because the shutting down society will result in death. And so they didn't do that, whereas we're under some bizarre fallacy, and this is a blessing of our prosperity, that somehow we can shut down society, print money, and that somehow that equates economic production. Economic production is just not dollars. Economic production is actually things being made, services being provided, and that includes food and education. And, there was actually, there have been studies that have suggested that when you cut education, people's lifetime earnings go down. And as their lifetime earnings go down, people who earn less over the course of their lifetime tend to die prematurely. So you could make an argument that in an attempt to spare our elderly vulnerable today, we are damning our children to a premature death when they themselves are elderly.
That's a great op-ed there, Chad.
Already did it. So feel free to share it. Actually, I think I did. I don't know. I've written so many recently; it's hard to remember always. I made that point on a different show. The other thing, and I haven't written this one, but I thought about doing it, was that it proves, on a slightly different note, I think what we've seen with COVID is that it disproves the Marxist concept of society raising children, because the best proxy to what would be a societal caregiver are the teachers. And the sad truth is when the first hint of danger arrived with COVID, the teachers union,
they headed for the hills.
Ran for the hills.
Yeah,
they ran for the hills, and so what that shows is there is no substitute for family, and the Marxist concepts that want to degrade the family are incredibly dangerous, because parents will stand through danger to take care of their children. Surrogate caregivers of the state would not do so.
That's an excellent point. I love that. That's fantastic. Lastly, every single day, every Democrat politician, especially Joe Biden, is basically blaming Donald Trump for the handling of the COVID pandemic, and that according to Biden, 200 million lives in the United States could have been spared if Trump would have handled the COVID the COVID pandemic differently. And yet we are seeing COVID on the rise in Europe. Is that Trump's fault too?
Yeah, no, it's craziness. It's all selective, right? How people are interpreting the data. So if you said back in March, when the projections that 2.2 million people in the United States were going to die from this, and you say, well, guess what? We're going to take some grand steps and reduce it to 200,000, there would have been great adulation and celebration. But since they have to change the goalposts, because no matter what really happens, the narrative has to be that Trump somehow failed.
Yes.
And they could have been 2 deaths, and they would have said, those 2 people, they would have been alive if not for Trump.
Right.
So really the numbers don't matter. The narrative was the same. They make the numbers fit the narrative.
Yes, absolutely. Well, I think that we've covered a lot of ground, and like I said, I wish we had another hour. We really have so much more that we can say. But I appreciate you being on today, Chad, all the hard work that you've put forth trying to educate the American public. I want to urge everybody to listen to the things that we've talked about today, and if you have not voted, go vote, and vote accordingly based on preserving our country. So, Chad, thank you for being with me today.
Yeah, thanks, Al.
All right. Well, come back next time in the Doctor's Lounge. I'll be back in 2 weeks, and we'll have voted on by that time, and we'll see where this goes. So, thank you for being with us.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you,
Chad.
Hey.